One question that's come in, doctor, from one of our audience is how to identify lupus. Is there any diagnostic tests available?
Okay. So there are some, typical presentations which will say that, okay, the possibility of lupus diagnosis is there. And the number one, is the age and the gender of the patient. So if it's a female patient who is having non-specific symptoms like fever, joint pains, maybe some rash on the face, oral ulcers, losing weight, and it's been going on for 6 to 12 weeks, we need to think about an autoimmune condition. And the commonest in these patients would be a lupus if there is a lash. So for a rheumatologist, because the patient may have seen multiple doctors before coming to us, it could be their general physician, the internal medicine specialist, or the orthopedic, depending on what symptoms they have.
Right.
So we have the advantage of time where the disease has evolved over the last few weeks or months. It's like like a portrait. If it's half finished, we don't know what it is. But maybe sometimes when we see the portrait, it's full and we can guess, okay, this is the problem of lupus which is going on.
Right.
Once the clinical diagnosis of lupus is suspected, there are tests which can be performed, which include a blood test. So the commonest test that we do to confirm the diagnosis is called the anti-nuclear antibody test, or the ANA test.
Right.
And then we do something called the ANA profile or the ENA profile to confirm the further antibodies which are present. And along with this, we do some other tests, looking at the hemoglobin, looking at the urine exam, looking at the creatinine, complements. These help us to basically assess how aggressive the disease is, how much it has affected the patient, and then plan the treatment. So definitely the clues are there in the history and exam, and they are consolidated by the investigations and the clinical examination.
Okay.